Parents and caregivers want what is best for their children, but is letting them eat what they want really the best? There are potential health risks that could last a lifetime. Environment also plays a role on the obesity level of our youth. Statistics show that a child that is overweight has a greater chance of being overweight or obese as an adult. Augustine and Kimbrough state that 21.2% of children ages 2 through 5 were obese, and 10.4% of children in preschool were obese. The problem with obesity is starting at such a young age, and times are changing, but our children's diet shouldn't be one of them. So parents should aim for healthy diets for their young ones and to teach good habits. Children learn from their parents and peers. If the child's parents don't have a structured meal plan and don't oversee playtime activities, the likelihood of that child becoming overweight is high. Stopping at a fast food restaurant might be more convenient, but it's not a good substitute for dinner. Fast food chains target our young by selling toys and familiar characters to entice our children into purchasing unhealthy foods. Families today eat dinner together less and less, even though preparing meals at home is more likely to be healthier than stopping at a fast food restaurant. Budd and Heyman share that eating meals outside the home has increased 89% since the 1970s, and that a child's early experiences in the family environment influence later food preferences and activity levels. Meals should not be replaced with a fast food burger. Our environment and life change, but we need to keep in mind what a well-balanced meal is. In Amanda Chan's article, Junk Food Nation, she states that there is a general lack of importance placed on meal planning in the American culture, meaning that there is a lot of families that do not take the time to plan a healthy meal and to cook and to eat together. Parents don't realize the effects their actions and environment have that's lived in on their children. From living arrangements to income levels of households to parents' marital status. Research shows that girls raised in single-parent households compared to two-parent families have elevated risk of obesity, and that children in households under the poverty level have twice the odds of obesity compared to children in households 400% of the poverty line or above. Now, parents know that there are some things in life that can't be controlled, but when it comes to the health of their children, we would do anything to make sure that they are healthy. If marital status can't be controlled, that's fine. The child won't be as affected by that as they would an income level. Education has a big effect on income and on children. Mother's education and family poverty status are well-documented risks to potential children's weight status. Augustine and Kimbrough state that children have also been shown to have lower BMIs in single mother households where the mother has a high school degree versus mothers with less than a high school education. Children see their environment much more differently than adults do. Children see it as guidelines to what life is supposed to be. To an extent, most children will follow in their parents' footsteps through life. Heyman discusses that healthy food and fresh produce have been less likely to be found in stores located in poor neighborhoods. For poor neighborhoods not to have access to fresh produce because it's too expensive is just sad. Children shouldn't have to suffer because a bag of potato chips is cheaper than a bag of apples. To stay healthy, you must eat a well-balanced meal and exercise accordingly. Today that can seem very hard to do. It's much easier to grab a quick bag of chips or a fruit snack for your child while they are enjoying their favorite show, but it's not the healthy way. Parents must take the time to make sure that their children have a well-balanced meal. This teaches good lifelong lessons. The rise in healthcare costs for people that are obese has risen significantly. In 2009, healthcare related to obesity topped out at $149 billion, which is said to increase due to as obese children will develop other health problems. Healthcare plays a big role in lives. Individuals must have physicals every year to make sure that they know whether they are healthy or not. Sometimes we may feel fine, but there could be an underlying problem. In cases of obesity, people tend to avoid going to the doctor. Research has documented that obese individuals are likely to evade healthcare, neglect preventative services, and avoid discussions about weight management with healthcare providers, thereby increasing the risk of chronic conditions associated with obesity. Children with obesity will do the same. They will say they feel fine when they really aren't. Obesity has become one of our nation's leading problems, even described as a pandemic. Obesity can be responsible for the types of diseases including type 2 diabetes, hypertension, and cardiovascular disease, just to name a few. It also states that it can reduce the life expectancy of this generation's children. Our next generation depends on today's children. Teaching children today the importance of eating is very important. Nurses and doctors are here to help you. In direct care, nurses partner with patients in implementing individually tailored strategies for behavior change, education about behavior modification, and skill sets for changing specific behaviors and strategies for relapse prevention. Obesity can be corrected to an extent using diet and exercise, going to the doctor, and the willpower is what you will need to achieve that goal. As parents or caregivers, we want what's best for our children, but is letting them eat what they want really the best? There are potential health risks that could last a lifetime. Environment also plays a big role on the levels of obesity of our youth. Diet and exercise will significantly help any human being, not just children. The Center of Disease Control recommends moderate to vigorous physical activity for at least 60 minutes per day, 5 days a week. Parents should teach their children lifelong lessons and values that rather than doing everything for them. Parents that live in poor neighborhoods might be able to go back and get their high school diploma if they don't have one, and to show their children the values in life. Show your child to fight for what they want and not just give into the scenario in which they are in. Make sure you see your doctor regularly. Nurses and doctors are here to help you if any issues arise. We all care about our children and want what's best for them. It's time we stand together to protect our youth from this potential harmful risk. As parents, we should also get out and play with our children. It'll do us good too.